Multiple sclerosis, commonly referred to as MS, is a chronic inflammatory disease of the central nervous system. It is characterized by lesions and damage to the myelin sheath surrounding the nerve fibers, which may disrupt normal nerve conduction and lead to a wide variety of neurological symptoms. The specific diagnostic standards are outlined by the McDonald criteria honouring an MS researcher. More recently, diagnosis has shifted from being based solely on the concept of lesions being disseminated in time and space to a more biological focus, such as brain inflammation around the small brain veins. Diagnosis is therefore partly based on clinical evaluation, involving a neurological history and examination, but more notably on paraclinical evidence, most commonly coming from MRI scans of the brain and spinal cord showing characteristic MS lesions. Unfortunately, conventional MRI findings are not specific for MS and can also be present in many other diseases. Because of this overlap, misdiagnosis is a known problem to MS. Historically, cerebrospinal fluid has also been extracted to further support the diagnosis of MS, as it can indicate inflammation within the nervous system. However, this entails a very painful procedure called a lumbar puncture to take place. The central vein sign is a promising diagnostic biomarker that was recently added to the McDonald criteria. It is more pathology specific and therefore increases the accuracy of MS diagnosis and can bypass the often unnecessary painful lumbar puncture procedure. Unfortunately, due to a lack of awareness for how to capture, analyse and interpret the central vein sign, there has to date been limited uptake of it in the medical field. To help encourage its use, the following video series will cover some of the key topics regarding the central vein sign, including what the CVS is, how it can be measured, and how we can interpret the readings.